Hello everyone, welcome. So we are here live with Dr. Pradeep Pawar, Dr. Vivek Nalrikar, Dr. Chambulkar, myself and Dr. Ankit sir. So we will be discussing on two main pointers. I'm sure you must have got to the next and there is lots of panic there. Will I be able to clear? This exam is big, exam is more clinical, what to do, what to primarily do for the first and second year. So that is going to be a first thing. So how to prepare for the first and second year subject. Vigneshwaran, I will listen to you. We'll definitely come up with how to prepare for the 2019 batch as well. We'll have something which is very special and big for all the interns, post-interns and final years. So we'll take that also very, very soon. Right. So now this session is primarily for the first and second year students who are going to enter first year, who are in second year, not knowing on what to do, because you must have been reading something. So the major concern for most of the students is it really important for me to read Anat, Physio, Biochem, Path, Pharma, Micro, your forensics and PSM? And if it's important, what to read? Because that's a major question. So that's what we're going to discuss here throughout. And maybe with your queries, we'll make it definitely useful for you. And we'll give a clear-cut plan. And we have something which is going to be a new addition to the PW live lectures. We'll announce that also very soon. Fine. Okay. So first, Pradeep sir, how do you think a student should approach anatomy going forward? Keeping in mind, the exam is going to be predominantly on 6 subjects with 540 questions. So how do you think students should start reading anatomy from now on?
See, as far as anatomy is concerned, we'll be teaching you like say a particular topic like axilla. So we'll be teaching you the details of the axilla, the boundaries of the axilla, the floor, the walls, what are the contents of the axilla. So this thing you should know. These are certain basic things that you have to know before you go for your next exams, because you won't have that much time to revise and go through in the final year. All the clinical aspect will be asked in the next exams. So we'll be focusing on the anatomy, the topic, as well as the clinical aspects of anatomy, so that later it will be easy to correlate with surgery for you. Ranjit sir.
Thank you, sir. Vivek sir, how do you think a student should start learning physiology? Because the concern quite a students ask me is like, should I read the millimeter per mercury? Should I read the value? Should I know the normal sodium concentration, potassium? Is it really important for me to know the normal to solve a scenario-based question? Your take on and your advice to students how to start changing their way of approach guided towards next exam.
Hi, good evening, Ranjit sir. Good evening, all students. My first thoughts on this change scenario is कि बहुत सारे स्टूडेंट्स को लास्ट बॉल पे छक्का मारने की आदत रहती है. मतलब हम कहते हैं ना कि लास्ट बॉल पे 6 मारा और जीत गए. If you have that habit, you will have to change it now. If you are, that type of a persona or that type of a student. Why I'm saying this is because first year, second year, third year, and then next exam वो last ball है. लेकिन आपको उस last moment तक you cannot keep your preparation hanging. What I'm trying to say is कि first year subjects will be as much relevant for you to understand the next year, second year, third year, and final year subjects. For example, physiology. I always say this not because it's my subject, but because it's a fact that physiology comes in every other subject of medicine. So let's say if you are reading murmurs in medicine, now that's a medicine part. But unless you understood the cardiac cycle part in physiology, you will not be able to understand the murmurs and their timing and the intensity, etc. And the thing is, you cannot start preparing for the medicine when you go to final year. Your preparation has to start now. आप cardiac cycle पढ़ोगे तो इतना अच्छे से पढ़ना पड़ेगा in the first year, इतना जबरदस्त hang होना पड़ेगा उस topic का कि then you will understand the medicine part of it in the final for the final year, that 1 year or final prof subjects for the next exam. So my take is simple. This is going to be a slow and steady. You will need to be a Rahul Dravid, so to speak, that playing steadily like a wall, build the subjects brick by brick, so that that one final year that you get for preparation of the final exams, for the next exam, you will be in a very good position. So, Dr. Ranjit, that is my initial thought process once this NExT was announced.
Thank you, sir. Ayush, you have a question on when the notes will be released. The first and second of notes are being printed as we speak, and we'll have the pre-orders maybe by the July 1st week. I hope that will settle most of the things. Soft copy notes of almost everything is available in the app. Maybe 5% of the videos are not there, which we'll definitely upload soon, right? So, Rajesh sir, your take on how clinically a biochemistry as a subject is important, because as an undergraduate, the memory of biochemistry is about cycles, enzymes, rate limiting steps, and lots of things to remember. How do you think a student should change their way of approach to biochemistry so that they can excel in the exam? Over to you.
Hello everyone. Hello all of you. So I will give you one example. Take example of diabetes mellitus. You know that there are 3 cardinal symptoms, that is polyuria, polyphagia, and polydipsia. If you don't know the basic behind the why there is polyuria, why there is polyphagia, okay, you should know the basic behind this, and you should know which tests are to be done on this patient. For example, Rothera's test, Benedict test, what is clinical interpretation of these tests. जैसे सर हमने अभी पिछला जो सेशन लिया था FMGE का सेशन, तो कुछ लोगों के कमेंट्स आए थे, जैसे मैं रोथरास टेस्ट पढ़ा रहा था और कुछ लोगों के कमेंट्स थे कि सर आप तो फर्स्ट ईयर MBBS का पढ़ा रहे, आप इसका मतलब PG एंट्रेंस के हिसाब से नहीं पढ़ा रहे, ठीक है। और वो कमेंट कब था, जब रोथरास टेस्ट में पढ़ा रहा था, और नेक्स्ट जो एग्जाम हुई उसके बाद वाली, उसमें रोथरास टेस्ट पे क्वेश्चन था, डायरेक्ट क्वेश्चन ऑन रोथरास टेस्ट, इमेज बेस्ड क्वेश्चन ऑन रोथरास टेस्ट। सो ऐसा नहीं है कि अभी आपको फर्स्ट ईयर सेकंड ईयर के टॉपिक्स पढ़ने नहीं है, आपको वो पढ़ने हैं, लेकिन थोड़ा सा अलग ढंग से पढ़ने हैं, थोड़ा सा क्लिनिकली ओरिएंटेड इसमें पढ़ने हैं, आपको उसका प्रैक्टिस करना है। वो जो क्लिनिकल उसका सिनेरियो है, क्लिनिकल और अप्लाइड एस्पेक्ट्स है, वो चीज से रिलेटेड, जैसे इनबॉर्न एरर्स, पेडियाट्रिक में इतने सारे इनबॉर्न एरर्स है, सबका बेस बायोकेमिस्ट्री में है। ओके, मेडिसिन है, मेडिसिन आर्टेरियल ब्लड गैस एनालिसिस, ऑल arterial that is disorders, acid based disorders, all normal values. If you don't know the normal, how can you interpret whether it is normal or abnormal? So all these things, the clinical aspects, applied aspects of the topics, and integration with other subjects, it is very, very important. So your base should be strong. The first year, second year topic should be strong, so that you can prepare for the third year topics. Over to you, Ranjit sir.
Thank you.
Ranjit sir. Like 2 years back, when there was a hawa of NExT coming through, so students were wondering why should we read this. So मैंने थोड़ा सा modify किया था my way of teaching. Topic था axilla, उसमें था there's an infection and where should the incision be given. Answer was simple. Answer was base of axilla, but students were not able to recollect the boundaries of axilla at that time. So that is what we will be starting from first year. First year में ये सब basic clear हो जाएगा. So later it will be easy for the students to understand and correlate things.
Okay, thank you, sir. Thank you, sir, Rajesh sir and Pawar sir. There are a few questions like fund doctors. You asked that will a FMGE student be required to give NExT exam or not? Yes. Once the NExT exam is implemented, be you are an Indian doctor or a foreign doctor, you have to go to the same system only. You have to give NExT 1, get an internship, NExT 2, then go outside. Arpit, will FMGE 2023 happen? There are lots of newspaper which has claimed that May 24 will be the first NExT exam. But again, Gazette of NMC is not yet out. So if the newspapers are right, May 24 will be the first exam. Keeping that in mind, December might happen. Again, these are all speculations. If the newspaper is right, December might happen. INICET November might happen. But if the NMC is going to say, I'm going to keep it on November 23, then these 2 exams might not happen. Fine. Okay, great. Arun, the NExT exam will be in the control of the NMC, not your university or your college. So it's going to totally go into under control of NMC only, right? So all of Pradeep sir, Rajesh sir, as well as Vivek sir told how they're going to prepare yourself for the next one for the first year subjects, right? So let me start the thing from a student's perspective. See, if I am a student, what will be the best advice I would give for myself is what I'm going to look. So I am going to write an exam at the end of final year with 540 questions. So there are 2 challenges here for me. One, I have to get used to solving an MCQ. It's not about what subject it is. I have to get used to how to solve an MCQ, because MCQ solving is an act. Some of you who might have given exams, you know that by looking at the question, you know this is the right answer. You don't know why it is the right answer. That happens always because you solve more MCQs, you get into that system, right? So that's the first thing you have to do. So starting early, first year, second year makes much more sense, because it's not a 200 exam paper, it's a 540 exam paper questions, and they are going to be lengthy. So you need to get tuned to it very slowly and gradually. Second thing for me is what to read regarding pathology. Should I read everything in Robbins? Bluntly, I would say, if my target is going to be clearing next one exam, answer is no. Because there are definitely few topics of pathology which are more theoretical compared to practical. Maybe I would feel that the importance of hematology and systemic pathology will become a little bit more compared to general pathology with respect to MCQs. But to understand a disease, to what test to prescribe when I become a future practitioner, yes, I need to have a little bit of base of it, right? So now onwards, be it your first year or second year, start preparing in the way that I have to solve a clinical scenario. At the same time, when you're very early, it's difficult for you to solve a clinical scenario if you don't have much of input. So read first year with all these legends here, the clinical aspects of it. So once you go to the second year, you will have postings. Please attend the postings so you can apply them. Complete the second year with the input of postings. We'll definitely help you. Myself, Ankit sir and Mamta ma'am is not available here. We all will help you to how to go about that, right? And then once you go to third year, you'll have confidence in solving a scenario. With this basics, you'll be definitely able to answer them, right? We'll definitely pivot. We'll definitely change the way of our approach. We'll ignore all the factual things. We'll go more clinical, more analytical, or more problem solving, like what NExT propose, and we'll definitely help you with that. Ankit sir, your take on how students should read pharmacology. Is half-life going to be important? Is adverse drug reactions going to be important? Or classifications? Should I memorize them? So what is the answer for that, sir?
Thank you very much, sir. बेटा मैं आपको हमेशा से ही कहता हूँ that फार्मा में ड्रग्स के नाम इम्पोर्टेंट हैं बट इतने इम्पोर्टेंट नहीं है. वी हैव टू लर्न द नेम ऑफ द फैमिली. नाउ रिमेंबर, जब आपका पेशेंट आपके सामने आता है तो सिर्फ मेडिसिन या सर्जरी पढ़ के काम नहीं होगा. उस पेशेंट के अंदर कुछ एनाटॉमी भी है, फिजियो भी है, उसके अंदर कुछ बायोकेमिस्ट्री भी चल रही है. एंड जब आपने डायग्नोज करना है तो पैथोलॉजी आपको पता होनी चाहिए, है ना. और फिर ट्रीटमेंट कर रहे हो तो फार्मा भी आनी चाहिए. सो इट इज अ वेरी वेलकम स्टेप आई बिलीव जो एनएमसी ने लिया है. नाउ वी विल, इससे फायदा क्या होगा बेटा? होगा क्या कि अब हम कोई भी चीज पढ़ेंगे एक इंटीग्रेटेड वे में पढ़ेंगे. हम चीजों को और आपस में कनेक्ट कर सकेंगे. सेम आई कैन टेल विद माय सब्जेक्ट. हमारे सब्जेक्ट को पैरा क्लिनिकल क्यों बोला जाता है? बिकॉज दे रन पैरेलल विद क्लिनिकल सब्जेक्ट. हमें क्लिनिकल सब्जेक्ट के साथ साथ हमें ये पैरा क्लिनिकल और उससे पहले प्री क्लिनिकल पढ़ने हैं. दैट इज व्हाई दे आर नेम्ड सो. नाउ रिमेंबर, what we can expect in next exam, it will be more clinically oriented, less factually oriented. इसमें facts कम होंगे, clinical based questions ज्यादा होंगे. अब क्योंकि clinical based questions ज्यादा होंगे तो अगर आपने देखा होगा when we apply our knowledge in front of a patient, हम बहुत rare drugs या बहुत नए drugs नहीं use कर रहे होते. हम ज्यादातर काफी commonly used drug use कर रहे होते हैं, like aspirin use कर रहे हैं, paracetamol use कर रहे हैं. तो हमें हर ग्रुप में मेन ड्रग के बारे में पता होना चाहिए. यस, थोड़ा बहुत हम कंपेयर कर लेंगे कि नए ड्रग उनसे अलग कैसे हैं, बट हमें मेन ड्रग पता होना चाहिए और उस ड्रग के बारे में हमें बहुत डिटेल में जाना होता है. बाकी ड्रग तो ऐसे ड्रग को हम प्रोटोटाइप ड्रग बोल देंगे. तो इस प्रोटोटाइप ड्रग से नए ड्रग्स डिफरेंट कैसे हैं, ये अप्रोच बना के हमें पढ़नी होती है. ओके, एंड रिमेंबर, जब हम फार्मा पढ़ेंगे, सिमिलरली आप अदर सब्जेक्ट्स पढ़ेंगे, पैथोलॉजी और माइक्रो, रिमेंबर दे विल सेट अ फाउंडेशन फॉर यू पीपल टू एंटर इनटू क्लिनिकल कोर्सेस. हम फार्मा में सिर्फ एंटी हाइपरटेंसिव ड्रग्स नहीं पढ़ते, हम वहां पे बीपी का मैनेजमेंट भी पढ़ते हैं. फिर जब आप मेडिसिन में आते हैं तो बचता क्या है? सिर्फ एक चीज बचता है कि डायग्नोज कैसे करना है बीपी. एग्रीड? बाकी चीजें हम पहले ही पढ़ लेते हैं. फाइनल ईयर में आपकी रिवीजन होती है. तो इसीलिए अभी राहुल ने एक बात पूछी थी कि सर फाइनल ईयर की तैयारी कब शुरू करें? रिमेंबर, द बेस्ट टाइम टू स्टार्ट रिवाइजिंग योर फाइनल ईयर इज मिड ऑफ योर सेकेंड ईयर. व्हाई मिड ऑफ सेकेंड ईयर? बिकॉज शुरुआत में आपका एक बेस बन जाए सेकेंड ईयर का. उसके बाद जब आपको चीजें समझ आने लग जाएंगी, स्ट्रीमलाइन हो जाएंगी, तब आप साइड बाय साइड अपनी मेडिसिन के बुक, सर्जरी के बुक, ईएनटी के बुक कोरिलेट कर सकेंगे. इससे पहले आप समझ नहीं पाएंगे. एग्री? देन यू विल हैव 2.5 years to learn all clinical subject, and if you will follow this consistently, I believe all the faculties here will agree, you will get passed and you will get a very good rank.
Thank you, sir. I wanted to add to Rahul's question as well. When to start reading for medicine? Because yes, it's a big subject. That's when you have postings. You have postings from second year, third year, and then final year. So in postings is where you understand the clinical aspects of it. Let's say you are seeing a case of CVS, mitral stenosis. You learn a little bit about that. Simultaneously, you know what's the problem in physiology, the heart rhythm, and you can understand murmurs. You can know the management of heart failure when heart failure happens with pharmacology. So the integration, what NMC was talking about so long, will become more applicable when the next happens. And yes, you should not wait till final year to read final year subjects. Every posting starts very early. Community medicine posting starts early. Medicine, surgery, OG posting starts early. So start early and please attend your clinicals. That's what I was saying. If you attend a posting, you know where to focus and where not to focus. Like Ankit has said, not all drugs in textbooks are available in the hospital. So only go to the hospital, you'll know what drugs are being used. Because if the exam is going to be so practical, only those drugs going to be coming in question, right? So you get aligned. Don't panic. It's uniform for everyone. It's completely fine. They're changing it. See, when I wrote my NEET exam, I was the first batch of NEET exam. So they had 30 exams, 15 days, 2 sessions each. So that was a huge amount of panic for all of us. And later on, our MCA decided that that's a wrong step and they make it 1-day exam. So all these changes will happen. Yes, unfortunately, I was a scapegoat that time. And unfortunately, 2019 batch has to get the brunt of it. It's not in our hands, right? So Saptarshi has a question on what should second prof student do now? So Ankit sir, what should a second prof student do now?
Sir, कुछ नहीं करना. What they have to do, अपनी बुक खोलनी है और हमारे साथ बैठ के पढ़ना है. इसके अलावा see, whatever the exams they will make, if they will change the pattern of the exam, it doesn't affect us. यार पूछा तो वही जाएगा, है ना? सिंपल सी बात है. जो हम पहले पढ़ते आ रहे हैं वही पढ़ेंगे. अगर कहीं बच्चे इस वक्त जो चैट बॉक्स में हैं, आपने हम सब फैकल्टीज की लाइव क्लासेस अटेंड की है, एंड डोंट यू थिंक हमने जब अपनी लाइव क्लासेस दी हैं, हम सीधा ड्रग के नाम पे जंप नहीं करते, हम सीधा H&E पिंक और वो वॉयलेट वाली स्लाइड पे नहीं आते, प्रदीप सर सीधा बोन पे नहीं आ जाते. हम पहले उसके बारे में कंसेप्चुअली पढ़ते हैं, और जब हम कंसेप्ट्स बनाते हैं, फाइनली हम उस चीज पे आते हैं जो आपसे पूछा जाता है. रिमेंबर, इस प्रोसेस में हम जहां से शुरू करते हैं और फाइनली जहां तक आते हैं, इस प्रोसेस में आपको बहुत सारी चीजें समझ आ जाती हैं, और वही इंटीग्रेशन है. एग्री? तो हम कभी भी कोई भी चीज पढ़ाते हैं आपको, यहाँ पे कोई भी फैकल्टी, रिमेंबर हम ऑलरेडी आपको इंटीग्रेटेड फैशन में पढ़ा रहे हैं. ये हमारे लिए, हम वी आर नॉट डूइंग समथिंग न्यू. हमें पता था ये पहले से आना है. वी ऑलरेडी स्टार्टेड प्रिपेयरिंग फॉर ऑल दिस थिंग 3 years बैक ओनली. तो जैसे हम पढ़ते आ रहे हैं, हमें वैसे ही पढ़ना है. Yes, आपके मन में डाउट आता है, we are there to help you and we are always ready to clear all your doubts.
Thank you, sir. Fun doctors, can an FMG student attend the next mock exam going to be held on 28 July? The release prospectus from AIMS says that final year students are eligible. If you are in the final year of your respective college, yes, you become eligible, because I don't know what will happen to the rest of the students, because I am sure most of them will apply. So how they're going to filter out, we are not yet sure, but yes, only final year students are eligible as per the AIMS prospectus. So if you're in that bracket, yes, you can definitely give the exam. Fine. So I want to add one more thing. So for your foundation to be very, very strong, so that you can ace your next exam, we have something very unique and very, very important to announce here. So from July 1st onwards, maybe that can be a Doctor's Day gift to all of you. So you are going to have daily practice exams. So let's say that Pradeep sir takes a class on anatomy, 2 hours live lecture. After the lecture, you'll have like 10 questions based on the topic so that you can practice. Same goes with physiology, Vivek sir's lecture or Jambulka sir's lecture, be it path, pharma, and micro, right? So daily practice test is going to be live from July 1st onwards, so that you can get your fears reduced. So you can listen to a lecture, apply the concepts, solve the questions. So daily, you're going to solve 10 questions. If you're a live batch member, you can daily solve 10 questions. Keep in mind, daily 10 questions for 2 years gives you a problem solving capacity what NMC wants. So you will automatically get tuned to solving an MCQ. So when you come to third year, you'll definitely be a pro of it. So with the extra knowledge of medicine and surgery, you can easily ace your next exam, next one, or be in next two, right? So that's our gift for you for the Doctor's Day. Daily practice exams are going to happen at PW MedEd, the live batch. So if you go on to the live batch, you'll have the videos, notes. The third part will be quiz. So it was coming soon so far, and it is time for us to launch that. And next, it will definitely help for your preparing next and your problem solving ability to acquire it much more early, right? So our exams are going to change to MCQ pattern in internals also. Palibal, no, it's not going to change in internals. Internals is the same. So here, it's a final year theory part is going to change to your MCQ pattern. That's all. Still, final year is going to have practicals. That will definitely happen. That will happen in your college only. Fine. Yes, Anisha, you can ask doubts. Tabasam has a question of in second prof, should we revise the first year? And Pradeep sir, Vivek sir, and Jamulka sir, you are the right person to answer. How do they revise first year if they're in second year or third year or final year? How they can approach it, Pradeep sir?
See, you must have done your first year. When first year, you must have read the topics while you were in first year. So second year में बस revision करना है, खाली clinical aspects देखना है, like clinical aspect of certain important topics that you have to know of. Abdomen में there are plenty of topics, like say for example pancreas. फिर वो clinical question ऐसे आएगा, a splenectomy is being done. So while removing the spleen, care has to be taken to preserve the tail of the pancreas. So which ligament should you be careful while cutting? So those clinical questions, clinical topics, you have to go through it. You can do that when you're in second year, because first year you've already read. So second year, it would be easy for you to understand and to go through the clinical MCQs.
Okay, thank you, sir. Vivek sir, your take on how a student in the third year or final year, if they feel that they're not strong in physiology, can they do selective reading of few topics, or how they can approach in a third year or final year or second year for that matter?
Yes. So basically, it would be a revision of the relevant parts and not the entire subject start to finish, obviously. For example, if you are reading digitalis in pharmacology or cardiac glycosides, you will have to understand the sodium potassium pump very, very clearly, and the transport processes, like digitalis binds to and inhibits the sodium potassium pump, and therefore the sodium calcium exchanger also would not work, and therefore the calcium stays inside the myocardial cell, and therefore contractility, cardiac contractility can increase. So to understand, for example, ANS pharmacology, you will have to understand first the ANS structure and the neurotransmitters, etc. So only relevant parts can be revised, and then you go on or proceed with your that year's subject and topic. Pharmacology, if you're reading pharmac and you find something like endocrines, for example, it will have a lot of basis on the physiology. It will be rooted in physiology, endocrine physiology. So therefore, just go through the relevant parts of the previous years. You must have taken out notes, or you have the ready-made notes of that year. Just go through those notes and take the relevant portion for the sake of understanding, and then you will read that year's particular topic or subject. So that is how, relevant portions will have to be revised again and again and again to consolidate it. I reiterate, Ranjit sir, that you will have to be someone like a Rahul Dravid batting, rock solid, and brick by brick, you are going to build your subjects for that finale, the next exam. So that is how the approach should be. You are reading your that year's subject, but revise the relevant portion first and then proceed.
Thank you, sir. Jambulkar sir, before coming to you, one question which I want to address in the comments. DPP, will it have clinical MCQs or theory questions? One of the common concern for every student. You have to understand that if you are in first year especially, I cannot give you a 5 or 6 line clinical scenario. You might not understand that, which will demotivate you, pull you down, and stop the process of learning. So what and how we have designed DPP is to, let's assume I have to read about heart attack. I need to know about heart anatomy. I need to know about the vessels. I need to know about the symptoms, ECG, diagnosis, treatment, right? So when I'm talking about any topic, so there will be few questions which will make sure your theory set is base. Then yes, tiny clinical scenarios, then bigger clinical scenarios. So it's an year-long journey. For you, it's going to be 4 journey, right? If in first year, we'll slowly start with introducing 2-3 question length, 2-3 line length clinical scenarios, so that you are aligned to scenarios. We can bombard you with 10-line questions, but ultimately, like I said, if I'm going to give a case history of 10 lines for a first year student, believe me, you will hate medicine. That's not a goal here. You have to learn, enjoy the process of learning, and this exam is a passing cloud. We have bigger things to achieve. So slow and steadily, and definitely Rahul Dravid is the best example if you're a cricket fan. Slow and steadily will slowly increase the length of the question, difficulty level. So once you come to the next exam, you're ready for everything, right? So Jambulkar sir, how a student can quickly read biochemistry? Like, is there any way or where all to focus on? Your take on that?
सर अप्रोच शुड बी इंटीग्रेटेड वे. जैसे कि फार्मैक में हम स्टैटिन्स पढ़ते हैं, लोवेस्टैटिन, सिम्वेस्टैटिन, या आपके घर में कोई बुजुर्ग होगा जिनको हार्ट डिसीज होगा तो उनके टैबलेट्स आप लोग चेक करना, उसमें कोई तो भी अटोरवेस्टैटिन या कोई तो भी स्टैटिन नाम का ड्रग रहेगा. ठीक है, दैट कम्स इन द फार्माकोलॉजी, ड्रग इन द फार्माकोलॉजी. कोरोनरी आर्टरी डिसीजेस और जो भी हार्ट रिलेटेड प्रॉब्लम है वो कहाँ पे आता है? मेडिसिन में आता है. अभी हमको जब हम सेकंड ईयर में स्टैटिन्स पढ़ेंगे या फाइनल ईयर में हम कोरोनरी आर्टरी डिसीज पढ़ेंगे, है ना, तब हम मैकेनिज्म हाउ इट एक्ट्स इट इज ए कॉम्पिटिटिव इनिबिटर ऑफ HMG कोए रिडक्टेज एंजाइम, द स्टेप इन द कोलेस्ट्रॉल बायोसिंथेसिस. तो ये हमको कोरिलेट करते आना चाहिए. जब हम स्टैटिन्स पढ़ेंगे तब हम HMG कोए रिडक्टेज भी पढ़ेंगे. जब हम कोरोनरी आर्टरी डिसीज पढ़ेंगे तब हम स्टैटिन्स भी पढ़ेंगे, मतलब फार्माकोलॉजी पढ़ेंगे, और फिर से हम HMG कोई रिडक्टेज वाली रेट लिमिटिंग स्टेप कोलेस्ट्रॉल बायोसिंथेसिस में आएंगे, तब हम कोलेस्ट्रॉल भी पढ़ेंगे, है ना. तो ये ऐसे हमको इंटीग्रेटेड कोरिलेट करते हुए जाना है और अपना स्ट्रॉन्ग करते जाना है, अपने टॉपिक्स जो है अपने स्ट्रॉन्ग करते जाना है. जैसे पेडियाट्रिक में आप जाओगे तो इनबॉर्न एरर्स आएंगे. कंसिडर एनी इनबॉर्न एरर, कंसिडर फिनाइल कीटोन्यूरिया विच इज कॉमन. ओके, फिनाइल कीटोन्यूरिया कहाँ पे जाएगा? पेडियाट्रिक में जाएगा. भी उसका बेस कहाँ पे है? बायोकेमिस्ट्री में है. That reaction which is blocked, why phenylalanine has to be stopped? The phenylalanine restricted diet should be given in patient with phenylketonuria. You should know the concept because the phenylalanine is already high. phenylalanine का concentration already ज्यादा है, इसलिए हमको phenylalanine नहीं देना है. लेकिन टायरोसिन कम हो गया तो टायरोसिन हमको सप्लाई करना है. तो बेसिस बिहाइंड द ट्रीटमेंट, बेसिस और व्हाट इज डिफेक्ट और व्हाट इज कॉन्सेप्ट बिहाइंड द ट्रीटमेंट, कॉन्सेप्ट behind the different symptoms, why there is neurological manifestations in PKU, that should be known. Okay, so integrated approach should be there. Over to you, Ranjit sir.
Thank you, sir. Thanks a lot. I'll address it before going to Ankit sir. You have a question as well from a student. So Arun, change of address, it's more of an administrative thing. Please mail to NMC. Let the prospectus come out clearly. If there's anything concerning, please mail to them. They will definitely sort it out, because you are not done it by a mistake. You're changing it. So definitely, I'll not be the right person to answer that. So I'm not answering about it. Rahul, first year free subscription for a second year student. We have something in mind. We'll definitely let you know soon how to make a foundation strong, be it first or second year. New batches of first year student. Let the college start. Let your counseling get over. I know you are very, very excited. Let your college start. You'll have a 1 month of orientation course in your college. Only then your lectures are going to start. So when your lectures start, by the time and when you get used to the formalin smell of anatomy dissection or the biochemistry test tubes and your physiology equipments, we'll definitely have the live batch, right? So there's no hurry. Don't worry. And you have done an amazing work in NEET UG. Relax, enjoy your time, because MBBS is going to be a very, very tough task. It's going to definitely grill you through. So relax for now. We'll definitely start a new thing. Sir, Ankit sir, there's a question for you. Like, should I start reading medicine, surgery, OG topics in my clinical postings? What's your take on that?
Yes, sir, definitely. I think that is a very good opportunity. आपके लिए बहुत अच्छी opportunity है कि आप सेकंड ईयर में स्टार्ट करें. आई टेल यू इसके 2 फायदे हैं. पहली बात, आप फ्री होके पढ़ेंगे, आपका कोई एग्जाम तो होगा नहीं. सेकेंड ईयर में आप क्लिनिकल पोस्टिंग चल रहे हैं, यू आर जस्ट आराम से फ्लो में आप पढ़ रहे हैं. जब आप बिना टेंशन के पढ़ते हैं, आपको बहुत लंबे समय तक चीजें भी याद रहती हैं. आपको डर भी नहीं होगा कि अगर मैं कोई चीज भूल गया या भूल गई तो कोई मेरा टेस्ट नहीं लेने वाला. आई थिंक सेकेंड ईयर में स्टार्ट सीइंग पेशेंट. रिमेंबर, ये एक ऐसा टाइम है जहां ना आप एकदम मिडवे में हैं. आप यहाँ से थियोरेटिकल पार्ट भी पढ़ रहे हैं और आपको पेशेंट एक्सपोजर भी हो रहा है. दिस इज द फर्स्ट टाइम वेयर यू कैन इंटीग्रेट योर थ्योरी पार्ट एंड योर प्रैक्टिकल स्किल्स. एंड द गुड थिंग इज नो वन इज टेस्टिंग you at that time, because once you will enter into your final year, you will have so much less time that there is so much course in theory कि आप वही पढ़ते रहोगे यार, आपके पास ना जाने का टाइम नहीं होगा, क्योंकि आपको थ्योरी पास करनी है, आप पे एग्जाम्स का स्ट्रेस होगा. सो सेकेंड ईयर हम अपने कॉलेजेस में, सर डोंट माइंड, हम अपने कॉलेज में सेकेंड ईयर को बोलते थे हनीमून पीरियड. द रीजन इज वेरी सिंपल, क्योंकि देखो पहले हम 11th-12th में इतना पढ़ते थे, टाइम नहीं मिलता था. फर्स्ट ईयर हर कॉलेज का डेंजरस होता है, बहुत स्ट्रिक्ट होते हैं प्रोफेसर्स, बट जैसे हम सेकेंड ईयर में आते हैं हमें पहली बार लाइफ में टाइम मिलता है. आप देखना, आप सब गोवा वोवा का ट्रिप मारोगे सेकेंड ईयर में, सेकेंड और थर्ड ईयर, फाइनल ईयर के बाद आप दोबारा वैसे ही हो जाओगे जैसे आप 11th-12th में थे. सो दिस इज एन अपॉर्चुनिटी, सेकेंड ईयर इज एन अपॉर्चुनिटी वेयर यू कैन इनिशियली अपने मन से जैसा आपका इंटरेस्ट है आप वैसे पढ़ सकते हो. एंड दिस इज द बेस्ट टाइम, मैं दोबारा कह रहा हूं, टू स्टार्ट योर क्लिनिकल सब्जेक्ट्स. एंड दिस इज ऑल्सो द बेस्ट टाइम टू रैपिडली रिवाइज योर फर्स्ट ईयर सब्जेक्ट ऑल्सो, so that you can integrate. And the good thing is no one is testing you at this time.
Very well said, sir. Paliwal, a second year student, if you are having your notes, important notes made, you can go ahead, the first year topics, you can go ahead with that. But if you feel that you're not understanding the entire topic, I would say go back to lectures. If you know your notes, if you can understand that, go with your notes. Otherwise, I would say go back to your lecture. Fine. After you are in foreign and you are not able to read properly a second year. See, we are living in an era of everything available on internet, right? So PW MedEd will definitely be available for you in your country. If not, please ping me. I'll make sure that's getting, you will get that in your device. And we have live courses for a person who wants a very stepwise approach. And we have recorded lectures also for a person who can read at their own pace. And like I said, live lectures will have DPP. So you will have practice and you'll definitely grow along with the classes. Fine. Dr. Pika, what will happen if a person has completed internship? As of now, this year NEET PG will be there, but I think next year they will combine it with the next exam only. So this year there'll be NEET PG. Hopefully, again, that's fingers crossed. There's an NMC come up with the cassette, and definitely we'll be able to know more clarity. We'll have more clarity when NMC announce it, right? So Shayant and Das has a question on what about third year students now? What do we do? Pradeep sir, what do you think a third year student should do now?
Third year students, you can see any part of surgery that you're going to study, any topic of surgery, the first thing given there would be surgical anatomy. Okay, so that will be given in short, surgical anatomy. If you are able to recollect that, your anatomy part, so well and good. Right, so go back to your anatomy books, just go through it fast. You might be having notes that you might have prepared in your first year. वो notes संभाल के रखिए. I always tell in my classes also, what are notes I'm giving, they're very lucid. Preserve those notes. You know, they're very crisp. तो वो एक झट से याद आ जाता है. अंकित सर, what do you say? Right? तो वो notes आप पढ़ो later. So it will add on. So your surgical concepts would be more clear once your anatomy is perfect.
Yes, sir. Sir, Vivek, sir, your take on how a third year student should manage, because final year students, they having a very, very less time to adapt. Third year students are definitely easily 1+ year to adapt. So how should they adapt, change their way of learning from now on?
See, make your weekly timetable first. Let's say you have 3 subjects and 6 days a week. Sunday, keep it for yourself. Then you know, so each subject gets 2 days, right? So first day you can have a revision of your past year subjects, and second day you will read the currently ongoing topics of that particular subject. That is how you can see every success has to have some kind of a disciplined approach behind it. So divide your weekdays properly and keep at least 1 day for or 1 or 2 days for revision of your first and second prof subjects. So and of course, as I mentioned previously, that relevant portions, not the start to finish subject of first and second prof. So a disciplined approach and relevant topics and relevant concepts recalled, and then approach that current year's subjects, and of course, if time allows, even the the subjects of the next exam or next preparation per se. So keep some time of every week for your MCQ solving and approach to the next exam. This is how it can be a three-pronged approach. Previous year's subjects, relevant topics revised, then current year's subjects reading, and then for the next exam, 1 day reserve maybe, and that's how you can proceed, Dr. Ranjit.
Thank you, sir. Rahul, for the third and fourth year subscription, if you want to read from the books, that's the perfect way. See the cases, read the books. Maybe once you clear your second year, we can definitely acquire the third and fourth year subscription. Altaf, I'll come with the 5-year subscription course, maybe an answer to that soon. Manish, you are a NEET PG student. I feel that if you've gone into it, and if you feel that you are very much eager to learn medicine, yes, you can subscribe to it. You'll have the first year subjects with you, record lectures already with you. We can go through it, fine. Amarnath, the third year notes, the soft copy notes of, like I said, most of them are uploaded already. Whatever is missing will be done with maybe in a 2-3 days time. Hard copy notes we'll announce very soon. Like I said, it will take some time for us to print, but pre-booking will be announcing it very, very soon. Fine. Okay, sir. We'll try to cut short the session, but like one line, what is next in your question? How it's going to impact the learner, and how do you think a student should modify themselves according to that? Ankit, sir.
See, with changing times, we all have to change. है ना? Darwin sir ने भी कहा है कि you will be fit enough to survive. But remember, ये बहुत बड़ा battle नहीं है. इतना भी हमें stress लेने की जरूरत नहीं है. See, we all have standard books and we have such a great faculty. मैं personally प्रदीप पवार सर से मैं खुद student रह चुका हूँ उनका. So
that is why I told about the notes.
So the thing is, see, the content जो होगा बच्चे वो कभी भी change नहीं होगा. उसको पूछने का तरीका बदल सकता है. The way of asking a question might change, but the content can never be changed. Remember, we have same number of bones in our human body. It will never going to change for at least next 10,000 years till another drastic evolution happens. So remember, the content will remain same. The way the people will ask you the question will change, and it will be changing from time to time depending upon the need actually. So remember, when we all are going to teach you, we all are experienced enough that what predictions the next might give us, we will be teaching you in that way. Yes, पहले हम कैसे पढ़ाते थे? If you compare 10 years back, हम सारे क्या करते थे? बहुत फैक्चुअल चीजें पढ़ाते थे कि इसका ड्रग ऑफ चॉइस ये है, इसका ड्रग ऑफ चॉइस ये है, ये वाली नर्व इसके नीचे से आ रही है. अब ऐसा हम भी नहीं पढ़ाते. नाउ वी आर ऑल्सो टीचिंग इन एन इंटीग्रेटेड मैनर, एंड आई होप बहुत सारे बच्चे यहाँ पे ऐसे बैठे हैं जो ऑलरेडी हमारी लाइव क्लासेस अटेंड कर रहे हैं. एग्रीड? लाइव क्लासेस में जब हम पढ़ते हैं तो हम बहुत ही कंसेप्चुअली पढ़ते हैं. एंड चेरी ऑन द टॉप, आज रंजीत सर ने अनाउंस भी किया है, टू मेक इट इवन बेटर एंड मोर कंसेप्चुअल एंड नेक्स्ट ओरिएंटेड, हमने इसमें डीपीपी भी ऐड कर दिया. दैट आफ्टर ईच एंड एवरी लेक्चर देयर विल बी सेट ऑफ अराउंड ऑन एन एवरेज 5 to 10 MCQs जो क्लिनिकल बेस होंगे. आप वही लेक्चर पढ़े, साथ में उसी MCQs को डेली प्रैक्टिस करिए, एंड आई विल इंश्योर यू, मैं आपको इंश्योर करता हूँ, आप चीजों को बहुत लंबे समय तक याद रख पाएंगे. And the things which we are teaching you in first and second year are in connection with your clinical subjects, because we faculty also talk with other faculties on regular basis कि सर क्या चेंज हो रहा है, कैसे डायग्नोसिस चेंज हो रहा है, तो वो भी हमसे पूछते हैं ड्रग ऑफ चॉइस चेंज हो रहा है कि नहीं. सो हमारी जो टीचिंग का मेथड है ये भी इंटीग्रेटेड है और नेक्स्ट ओरिएंटेड है, और हम आपको ऐसे पढ़ाएंगे, आपके लिए जर्नी बहुत इजी हो जाएगी.
Thank you, sir. Sir, Jambulkar sir, your take on how a student should look at NExT and what they should do right from first year.
देखो, अभी पहले क्वेश्चन कैसे पूछते थे, आई विल गिव यू वन एग्जांपल. पहले पूछते थे विटामिन सी इज रिक्वायर्ड फॉर दिस रिएक्शन. Suppose answer is hydroxylation reaction. Okay, this is question. Okay, now question will be asked like that. Why there is bleeding gums in scurvy? Got it? The same question. Why there is bleeding gums in scurvy, or why there is petechial hemorrhages or hemorrhagic spot in scurvy? It is related with collagen. It is related with hydroxylation process. Vitamin C, hydroxylation, collagen formation, collagen strengthening, and bleeding gums. It is related. It is like this. तो पहले जो अप्रोच था ये सीधा स्ट्रेट फॉरवर्ड अप्रोच था. विटामिन सी इज रिक्वायर्ड फॉर द हाइड्रोक्सिलेशन प्रोसेस. नाउ ब्लीडिंग गम्स क्यों होता, पेटिशियल हिमोरेजेस क्यों होते, उसके बिहाइंड अगर आप रीजन खोदते खोदते जाओगे तो अल्टीमेटली यू विल लैंड इन द विटामिन सी. ओके, दैट इज बायोकेमिस्ट्री. गॉट इट? सो अप्रोच द क्लिनिकल वे should be there, integrated approach should be there. The notes, your notes should be ready. When you are in third year, your notes should be ready for first, second, and your current year, so that your fourth year is completely free for the major subjects and revision.
Thank you, sir. There are a few questions like standard books or normal Indian author books. I would say read a chapter from both of them, which you're understanding better, go with that. It's not like one book is very superior to other. If you have a good reading, consistent reading of any book, it's going to give you a knowledge. It's not that I would still prefer Robbins pathology, but still if you're going with an Indian author book, if you're consistent in reading it and understanding it and seeing patients and linking it, any book is a good source. But please stick to reading books, right? And Robbins cover to cover is not required. Cover to cover of any book in medicine is impossible and it's not required, right? So read things which are required for application. And that will help you to definitely be it NExT or be it real life, you'll be able to handle that, right? Pradeep sir, single line advice on students on how to go with NExT.
See, first year perfect kar lo. Now we have also, changed. We have also modified our way of teaching. जैसे पहले पढ़ाते थे, now I'm teaching एकदम what is related from the point of view of NExT and the clinical oriented, which will help you to orient yourself when you go in the surgery departments and all. So we have changed a lot. Now it will be easy for you also to adapt. Notes dete hain hum log, so that notes you can read. That's it. It will be easy. Don't worry. And revise things. Revision is very essential.
Great, sir. So Vivek sir, your take on how a student should change the way of approach to the exam or the way of reading first or second year?
It should be a cumulative approach. You are building your subjects slowly. Read that application of clinical application of everything, and that is how you proceed. That's my take on this entire change scenario.
Thank you, sir. Thank you. Just to conclude, like all the valuable inputs you have got here, just my perspective of how a student should look at the NExT exam. Imagine your MBBS degree is a building where your foundation is important. The first, second, third floor, everything is important, right? So when I say the foundation is important, maybe not the beautification of it, but understanding most of it. Definitely few factual things in any subject, be it in medicine also has factual things, anatomy also has factual things. You might slightly lower it down. NMC is given the must know topics, 60%. First focus on that. The good to know 10%, don't focus on that. Keep it last. So I'll finish the first 60, then go to the next 30. If I complete this, go to the next 10, right? So don't panic. And what Ankit sir said was very, very true. No one here is going to create a new disease or a new bone or a new muscle. And even if it's created, it's not going to be 100% of your topic. It's going to be 0.1% of your knowledge. That's all. So to put in a simplest perspective, I have seen AIPGME questions, which is one-liner. NEET NExT had a little bit of 2-3 lines. NExT PG will have 5-6 lines. Maybe I'm coming in a coat and a blazer for one lecture, and I remove this and I come with a t-shirt for another lecture. That's the simplest difference about NEET or NExT exam. So if your core concepts are good and if you're able to read well, definitely I think you can ace any exams. And see, I always believe and trust that younger generations are any day more smarter than any one of us here. You're given a problem, you will solve it in the best way possible, and definitely we are there to guide. And what you're going to provide you is our experience in solving the problem. And you will definitely come up with more ways of solving the problem than we ever can think of, right? So don't worry about it. It's a change in exam. Let's see. Let NMC throw whatever it is, and we will hit for a 6er. maybe not like Dravid, but like Dhoni, right? So that's to end with the lecture. And thank you guys. If you have missed any of the questions, please text us on Instagram or Telegram of any of us or in the PW group. We'll try to solve every question of yours. I know that you need a constant support for the next few months at least to till all this chaos gets over, and definitely we'll be there to support you, right? Arun, the change in the documents, please, we are not the final authorities to answer that. So please write to NMC all your queries. And once it's documented and they reply, that will be the best way to go. Or if you have any prospectors saying that, please go with them. Fine. Okay. Thanks a lot, everyone. Thank you, sirs, for attending the, and hopefully we'll be help you to guide more, right? Thank you. Thanks a lot, everyone. Thank you, sirs.
Thank you, all of you.
Bye-bye. All the best.
Bye. Bye.
Thank you. Thank you.
हेलो हेलो हाँ मेरा ये ओबीएस का वापस नॉर्मल कर दीजिए ना हाँ एंड